Okay, so here is going to be the discussion on the wrist and hand joints. So when we look at the wrist and hand, really important area of the body, many sports and just activities in general, as we all know, if you think about what you do with your wrist and hand every day, requires a lot of precise functioning. Always, too, you want to relate your functional anatomy to joint action. So again, we look at flexion, extension, abduction, and adduction of the wrist and hand. When you take into account all of the bones of the fingers and the wrist joints, you're talking 29 bones, more than 25 joints, and more than 30 muscles. 18 of those muscles are what we call intrinsic muscles. So again, difference between an intrinsic muscle versus an extrinsic muscle of the wrist and hand. If it's an intrinsic muscle, that means that the origin and insertion of the muscle is all kind of housed within the hand itself. If it's an extrinsic muscle, that essentially means that the origin of the muscle is going to be down onto into the forearm and into the elbow region. So again, whenever we look at a body part area, again, there's always associated regions that we need to look at. So we're looking at the wrist and hand, but obviously the wrist joint or the radiocarpal joint is going to have an articulation with the distal forearm. So again, just to point out and note all of your different anatomical landmarks of the radius and ulna. So your radius and ulna are your parallel forearm bones. The radius and the ulna are going to serve as origin sites for wrist and hand movers. So that's why we're, again, talking about these regions kind of together, because a lot of the muscles that you're going to see are going to have origins down onto the radius and ulna. So again, take your time, look through the illustrations, and make sure that you're familiarizing yourself. Again, some of these landmarks we discussed in the elbow and forearm, so it should serve as a little bit of a review, but it's going to be important to know all these landmarks. So when we look at the bones of the wrist and hand, so the wrist, you have your 8 carpal bones. There's 2 rows of 4. So make sure that you know all of those. They articulate with the radius and the ulna. And then when you look at the hand, you have your metacarpal bones and your phalanges. So if we look at this picture, and it's a little small, you could kind of look at your textbook illustrations as well. You could see the carpal bones down here. So these are your carpal bones. These are your wrist bones in here. And you have 2 rows, okay? So you have your 2 different views here. Then you get into your metacarpals. So these are your metacarpal bones right here. Your 5 metacarpals. And then your phalanges, which in your phalanges you have a proximal, a middle, and a distal phalanx, okay? Now, the exception to that is at the thumb. At the thumb, you only have a proximal and a distal. You don't have a middle. Okay, your thumb only has one, what we call interphalangeal joint. Your fingers have 2. Okay, so in the fingers you have what's called a proximal interphalangeal joint and a distal interphalangeal joint, or what we commonly call a PIP and a DIP. In the thumb you only have an IP joint or an interphalangeal joint. Obviously the joint between the metacarpals and the phalanges are the metacarpal phalangeal joints. So, and this is important to point out, because when, many times when students are looking at models, this is something that I've seen get sort of mixed up. So again, you have your metacarpal bones. Okay, these are the bones inside your hand. Okay, so where that bone meets the first bone of your fingers is the metacarpal phalangeal joint. Then you have the proximal interphalangeal joint and the distal interphalangeal joint. Now at the thumb, you have, again, your metacarpal phalangeal joint, but then you only have an IP. So just look at your own hand and you could see that. You only have one joint at your thumb to kind of flex and extend that joint. So here's, again, just another view of the carpal bones. So the proximal row, and again, it's always kind of good to orientate yourself. So again, when you look at models in class or you're looking at a picture, in a quiz to do this, and you have to know all of these carpal bones. You have to know where they are. You have to be able to identify them, okay? So you may want to know them from one side versus the other. So if you look at the proximal row, go from the radial side to the ulnar side, and you could kind of, you could note where each of the individual carpal bones are. So again, as you look here, you can see all the carpal bones as they line up. So you have your proximal row, and then you have your distal row of carpals. So scaphoid, capitate, trapezoid, trapezium, and your pisiform, triquetrium, hamate, and lunate. Okay, so really take your time with both your reading and illustration with these, so you could kind of get these down as you're kind of looking through them. Again, also note, again, anytime you're looking at a picture, make sure you know whether you're looking at an anterior or posterior view. So here's the posterior view of the hand and wrist. Here's an anterior view. So that tells you, again, where you're kind of starting here. So from an anterior view, here's your radius, here's your ulna. So looking at the radius, you notice you have the scaphoid bone. Okay. Then coming across, you have the lunate. You have the triquetrium, and the pisiform kind of sits like on top of the triquetrium. You could actually palpate your own your pisiform bone. You could actually take it, if you pinch it, you could kind of move it around. So again, that's on the ulnar side. Then we come back over to the radial side. You have the trapezium, the trapezoid, the capitate, and the hamate. And you also notice when you look at your distal row of carpal bones, what metacarpals they line up with, okay? So the trapezium lines up with the first metacarpal, the trapezoid lines up with the second, with the third, you have the capitate, and then the fourth and fifth both align with the hamate. Okay, you can see the fourth and the fifth, they both align with the hamate. So, you may have to look at, look from your own standpoint, try to find one way to kind of know them going across. Again, I'm suggesting starting from the radial to ulnar side, start with the first proximal row and then go distal. Okay, that's probably one of the easier ways to do it, but you could obviously kind of do it however you want. So again, if we're going proximal row from the radial to ulnar side, the scaphoid, the lumate, triquetrium, and pisiform. So that's the proximal row. Then if you look at your distal row from the radial to the ulnar side, just as I said it, trapezium, trapezoid, capitate, and hamate. Now, everybody likes to kind of come up with different ways to remember these. There's all sorts of sayings out there for this. This is one way you could remember it if this is the way you like to remember things. So from proximal lateral around to the distal lateral, so long to pinky, here comes the thumb. That's one way you can possibly attempt to remember these, if that's the way you like to remember things. If not, again, just go from the sides we discussed and kind of carry it through that way. So just some little tidbits around the scaphoid is the most often injured bone in the wrist, and the mechanism of injuries from falling on an outstretched hand or arm are what they call a fuchsia mechanism. So a lot of times when people fall, their reaction is to kind of stick their hand out, and they land on that outstretched arm. And somewhere along the line in the upper extremity, an injury usually happens. Many times it gets dismissed as just a sprain because oftentimes the fracture actually doesn't show up on x-ray. So it's usually a good idea, because it could be a significant problem. The scaphoid has a tendency not to heal very well. So many times, even if a physician doesn't see a scaphoid fracture on the x-ray, if they kind of go into that area and palpate and feel it, and there's pain, many times they will still limit, or they'll basically immobilize the area and still treat it as a fracture. So usually a long period of precise immobilization or surgery that's required. Because basically an individual could end up with a lot of chronic wrist pain. You get what's called non-union fractures, where the fracture just essentially doesn't heal, and then the person will have kind of wrist pain and issues going forward. So many people, again, you probably, even if you have no background in anatomy, you've probably heard the term carpal tunnel syndrome. Okay, so that's where that comes from is what we call the carpal tunnel. So the median nerve kind of pierces through. I know we're not doing nerves, big time yet here in this functional anatomy course, but it'll be something that you see. But just to kind of show you. The carpal tunnel syndrome, you could kind of see the carpal bones form sort of a three-sided arch. So between the bones and the soft tissue, so here you're essentially seeing a cross-section of the wrist. So again, anytime, I can't stress this highly enough, when you start to look at an illustration, you may even want to pause the video and just take a minute to just look at this, orientate yourself to what you're looking at and the structures involved so you could understand. So if you're looking at this picture, so here's the median nerve right here. So this nerve travels through this area where there's all this soft tissue and the bones kind of aligning here. And what can happen is from overuse, poor posture, whatever, there could be some pressure taking place in there. And that's where the individual with, as we call carpal tunnel syndrome, starts to develop some of those symptoms, the numbness and tingling in the fingers, and the weakness and pain that they sometimes get associated with that. Again, going up into the hand, and again, I can't stress this enough. This is one area that a lot of individuals confuse when they're having to name the bones and joints. So please take your time with this, because this seems to be one of the biggest things that gets missed a lot. So the metacarpal bone. So again, these are the bones inside your hand. So 1 through 5. So starting at the first one at the thumb, here's 1, 2, 3, 4, 5. Okay? All right? So here you're looking again. Here's your anterior view. This is a posterior view of the hand. So that's how they're numbered, and they're numbered from radial to ulnar. Then you get into the phalangeal bone. So again, looking at this picture over here, this is what these joints here, 1, 2, 3, 4, 5. These are what are called your metacarpal phalangeal joints. Okay? So this is your first MCP joint. This is your second MCP joint. This is your third, so on and so forth. That leads into the bones of the fingers. Okay? So this bone here is your first proximal phalanx. Okay, so if you go to your thumb and feel that first bone in your thumb, that's your proximal phalanx. Okay, this is your distal phalanx. So the thumb only has two phalanx bones. You have a proximal and a distal. Okay, here's what's called your IP joint. So remember, the thumb only has an IP joint or an interphalangeal joint. Then as we go across, now we're at the first, or what we'd call the first finger. It's the second. Okay. Phalange, but basically here again, here's your second MCP joint, here's your proximal phalanx, here's your middle phalanx, here's your distal phalanx, here's your proximal interphalangeal joint, here's your distal interphalangeal joint. So again, take your time, orientate yourself with the picture. Again, you may even just want to pause for a second, pause the video, take a look at it. Even look at your own hand, okay? So again, remember in this, we're trying to learn the anatomy, but eventually you're going to have to, be able to look at like a regular human hand and be able to assess it and kind of understand what, where everything is within the hand. So make sure that you kind of make note of that. So as you're kind of going through, so you could just use your own hand and be able to find these joints and bones as you're going through this. So we know eventually we're going to be getting into the muscles. So any muscles that insert on the carpals and metacarpal bones are going to be responsible for wrist movement, obviously, because they're going to be creating movement at the wrist. Any muscles inserting on the phalange bones are going to be doing finger movement. So that's going to be an important distinction to make between the two. All right, so here as we get into the joints, we're going to look at phalange 1 or the thumb. Now there's going to be two joints. So you have the IP joint and the first MCP joint, okay? Unlike when we get into the phalanges 2 through 4, you're going to have 3 because you're going to have each one's corresponding MCP joint and then their corresponding IP joints, which you'll have a PIP or a proximal interphalangeal joint and a DIP, a distal interphalangeal joint. So your movements that take place here, and here's what you have with, so here's what you have with the thumb. So you can see where flexion and extension takes place at the IP joint, and you have flexion and extension at the MCP joint. Then you also have, if you look at the bottom, you have adduction and abduction. Okay, so here's the first, the thumb adducted, here it is abducted, and then you also have what's called opposition. So opposition is when you flex the tip of the little finger and bring it over to meet the thumb. So that's called opposition. Okay, now obviously at the IP joint you have flexion and extension. You're not going to have any other motions. That's a pure hinge joint. Flexion and extension also occurs at the MCP. So your MCP you flex and extend. These movements down here actually come more from what we call the carpo-metacarpal joint. So where the carpal bone meets the metacarpal. And you can see that for yourself if you prevent movement at your first metacarpal bone. You'll notice that at the MCP, all you can do is flex and extend. You can't actually adduct and abduct. So it's important to note that that movement actually takes place even more proximal at the carpo-metacarpal joint. Okay, so as I said, your phalanges 2 through 5 are going to have 3 joints each. And again, make sure when you look at a model, you can differentiate these. Again, I can't stress this enough. This tends to be an area of confusion when students are identifying these joints. Okay, so you have your metacarpal phalangeal joints at each one. Okay, we're looking at the side here. So here's your metacarpal. So this is the bone in your hand. So here's your carpal bones in your wrist. Here's the metacarpals in the hand. Here's your metacarpal phalangeal joint. Okay, that's the first joint. Then you have your proximal interphalangeal joint. That's right here. Okay, and then the distal interphalangeal joint. All right, so it's important to note because, again, students get these mixed up all the time. So orientate yourself to what joint you're looking at. Okay, remember at the thumb, so going back to the thumb, you only have 2. You have one metacarpal phalangeal joint and one interphalangeal joint. All right, that's when the difference is when you're looking at between the thumb and the individual fingers. Again, as I'm going through this, if you need to, pause as well. So, I mean, I'm going to transition through this as I'm talking. You can feel free. Pause the video, look at the pictures, make sure you're able to see at each individual illustration what it is that I was looking at. Okay, so movements. Again, movements at the wrist. So we have 2 degrees freedom of motion. We have flexion and extension, and we have abduction and adduction, or radial and ulnar deviations. At the phalanges, we have flexion and extension. At the MCP joints, they abduct and adduct. Now, the exception to that is at the thumb. So the MCP at the thumb only does flexion and extension. Abduction and adduction at the thumb is going to take place at the carpo-metacarpal joint. Okay, so that is one important distinction. So make sure you note that. Okay, so at the MCP joints, yes, ab and adduction, that's at fingers 2 through 5. Okay, but at the thumb, the MCP only flexes and extends. Okay, if you get to adduct and abduct the thumb, that movement actually has to take place at the carpal metacarpal joint. All right, so important to note that. And remember, pronation and supination occurs at the radial-ulnar joint, not at the wrist. Okay, so there is a distal radial-ulnar joint, okay, that is close to the wrist, okay, but that occurs at the radial-ulnar joint. That is, those are not wrist motions. Okay, so again, here's wrist flexion, and then there's phalangeal flexion, okay, or flexion of the phalanges. Okay, so that's showing you the movements in each instance here. Again, if we go back to looking at some other movements or other issues with the hand, the muscles inserting on the carpals and metacarpal bones move the wrist. Okay, so again, where would the flexors be primarily located? Well, again, if you think about it, they're going to be located on the palmar aspect. So now I do want you, as you have to know the details as far as the origin and insertions goes, but this is a starting point to get to know where they have to insert. So it would be obvious that in order to flex either the wrist or the fingers, that the insertions would all have to be on the palmar aspect, if you look at what that is. So wrist flexion is movement of the palm of the hand towards the anterior volar aspect of the forearm. So in order for that to happen, the shortening of the muscle has to occur and the insertion has to be on the palmar aspect. Muscles inserting on the phalangeal bones will move the phalanges. And again, where are the extensors located? The extensors are going to be located on the dorsal aspect. Okay? So extensors are going to be located on the dorsal aspect. Flexors are going to be located on the palmar aspect. So again, looking at movements, extension, you extend the wrist, it's movement of the back of the hand towards the posterior or dorsal aspect of the forearm. The phalanges, movement of the back of the phalanges towards the dorsal aspect of the forearm. Abduction, okay, or also known as radial deviation. When we're talking about the wrist, the reason why we call it radial deviation at the wrist is because the hand deviates to the radial side. So movement of the thumb side of the hand toward the lateral aspect or radial side of the forearm. The hand, when we're referring to abduction, we're just looking at movement of the fingers away from the middle finger. So you reference the third phalange or the middle finger, and it's movement of the fingers away from that finger. And then for adduction, for the wrist, it's ulnar deviation. And at the hand, it would be movement of the fingers back together toward the middle finger.